This session is going to be an overview of the strengths and many of the limitations of an economic approach to evaluating changes, interventions, new programs, new technologies, etc. So you can see for the photograph, I'm being very literal. It's an overview. Otherwise, I couldn't think what photograph illustrated what I wanted to talk about. Anybody get any idea what that might be a view of, or where it might be? Yeah. It's actually the view you get from the roof of the Oslo Opera House. And the interesting thing about this building, well, it's right by the water, as you can see, it's designed so you can just walk up onto the roof. You don't climb, you don't go in a lift, there's not stairs. It's largely just an incline that leads you around the building and onto the roof. It's a very interesting design. This is a view looking down. I didn't go into the Opera House, but from outside it's definitely an impressive building. Right. So, I think the place to start, and what I'm going to try and do in this lecture is pull together some of the elements I've talked about so far and put them all together. There's a whole series of challenges involved in making robust estimates of cost effectiveness. And you'll have got a sense of some of these already, but I'll add a few more in. And so in short, I want to emphasize that it can really be quite difficult to come up with convincing estimates of cost effectiveness. It's not an easy task, it's not a trivial task. But of course, what I'm going to be arguing is it's worth doing. It's difficult, but it's worth doing. The first consideration whenever you undertake an economic evaluation is, what are you comparing? So you can't do an economic evaluation without some element of comparison. So for example, I've just been talking about smoking cessation this morning. You can't evaluate a smoking cessation program without comparing to not having a program. Or, for example, if you're looking at some new treatment for a particular condition, plaque psoriasis, you can't consider is ustekinumab, one of these MABs, is cost effective or not, without comparing it to whatever your current treatment is. So I'll say a bit more about that in a minute. That choice of comparator is very important. Second set of issues, which I'll reprise with you, are this issue of modelling time spent in different health states. And this is what we spent a lot of time, our time, on in this second lecture. It has to be done if you're going to get a realistic picture of cost effectiveness. But it's again not straightforward. The third issue on this list concerns producing estimates, but in particular unbiased estimates, of the treatment effect, of how well the intervention works. Now, there's lots of challenges here. One of the most obvious, particularly when we think of clinical trials, is that the patients who are in clinical trials are typically rather different from the patients in routine clinical practice. In routine clinical practice, the patients tend to be older. In routine clinical practice, the patients tend to have more comorbidities. In routine clinical practice, to put it bluntly, patients are less well looked after. If you get a chance to be in a clinical trial, maybe you should take it, because you'll be looked after very well. There'll be a very clear protocol to follow, and they'll really try and keep to it. The real world's not like that, or is less like that. Now that is quite a problem, or quite a challenge, because it means you're getting an estimate of how well a drug or some other therapy works, but how well it works in a carefully selected group under fairly controlled circumstances. But of course, what we really want to know is how well would this drug work in the real world, in routine practice. Another issue that arises with obtaining unbiased estimates of treatment effects is that sometimes you've got multiple sources of information. And the question arises, how do we compare, or how do we combine information from different sources? Now, occasionally you've just got a single trial, there is no other estimate of the effect. But quite often, you've got a series of studies that tell you something about how well the treatment works. And the challenge is how to make the best use of that series of studies. And that leads me on, and I'll say a bit about it, a bit more detail about it shortly, to something called indirect treatment comparisons. Indirect treatment comparisons. This is a situation where you don't have data, what we call head-to-head trial data. You don't have data comparing intervention A to intervention B, but you do have data comparing A to C or B to C, but you've no direct comparison between A and B, which might be the thing you're interested in. And that's where indirect treatment comparison becomes an issue, and there's quite a lot of challenges there, and I'll say more about them. And then the last on this list of challenges in producing robust estimates of cost effectiveness is the topic that we spent a bit of time on Wednesday morning, and that's valuing the time that patients spend in different health states. So when we looked at genetic preference-based measures, EQ5D, things like that, when we looked at mapping from a condition-specific to a genetic measure, all those issues arise or can arise in an economic evaluation, making it harder to get a good estimate of cost effectiveness.